Hi friends, this is doctorramyamaduri. You're watching Skinaware. So you must have watched the part 1 about skin myths and facts. So this video will be the skin myths and facts part 2. Let's move on to the topic. So many people, they used to tie a hair onto their skin tag to get rid of it. I will tell you what will happen when you tie a knot onto your skin tag. So when you encircle and put a knot on your skin tag, the blood supply to that particular area is cut off. The oxygen supply is also cut off. Hence the chances of survival of the tissue is low. So it will start to necrose and separate from your body. This would have helped for some people in case of tiny skin tags. But what will happen if you are dealing with a very huge skin tag? Remember, this is not going to happen in one single day. It may take several days. When the tissue starts separating from your body, you will feel an ischemic pain because the blood supply is not there. Second thing is, half of the skin tag may be cut and half may be hanging onto your skin, which is going to cause you severe irritation and discomfort. One more thing is that you have not done anything under aseptic precaution, so chances of infection is also there, and it is going to be an emergency for you to get an appointment from your consultant to get rid of it. It is a very simple procedure which is being done as a OPD procedure by all the dermatologists, the radiofrequency cautery. You need not need any of the hospital stay for this kind of procedure. You can come as OPD and do the procedure in a minute. So you will be requiring a topical anesthetic gel and a numbing gel to relieve pain, and also sometimes in case of very huge skin tag, you will have a shot of a local anesthetic injection at that particular area. If you really need to get rid of your skin tag, please consult your dermatologist. So chickenpox is a common viral infection. We will be facing it once in our lifetime. And this is the only one condition which has huge cultural and religious belief with it. So when people get chickenpox, they do not seek treatment. Let me explain it to you what is chickenpox and why it requires treatment. Chickenpox is a common viral infection. This is a self-limiting infection. Self-limiting means you will acquire the infection, you will go through the symptoms, and it will resolve on its own. If I had mentioned it will resolve on its own, then why you require treatment? Chickenpox can be associated with various symptoms like fever, myalgia, that is body pain, and sometimes because of fever you can get dehydration, and the secondary infection in the skin is also common, and pruritus, that is the itching of the skin. And in some instances, people who have low immunity, that is immunocompromised patients like patients who have diabetes and other immunocompromised conditions, and especially in children, they can have some complication of chickenpox. For example, if a child has fever, the chances of dehydration is more, that is loss of water from our body. So at that time, the baby requires the medical attention. Second is that the people can get pneumonia because of a chickenpox. So third thing is that very rarely you can also have inflammation of brain, which is called as encephalitis. In common terms, it can be called as brain fever. So these are all the complications of chickenpox. So it is very essential to have a medical attention at that time. Even though the chickenpox has strong religious and cultural belief, we need to realize that it is a viral infection and we require a medical attention at that time. People think if they get any of blister in their skin, ultimately it could be the chickenpox. I agree with you, common things are common, yet uncommon things can also happen. There are so many conditions which can occur as blisters in the skin. Number one, bacterial infection, which is called as impetigo, which can occur as blisters in skin, commonly in children. Second, viral infection like herpes labialis, herpes zoster, and sometimes some drug allergic reactions can also occur as blisters in the skin. The autoimmune bullous disorders called as vesiculobullous disorders like pemphigus vulgaris, pemphigus foliaceus, dermatitis herpetiformis, and the list goes on. There are so many conditions which can occur as blisters on your skin. If you get any blisters on your skin, it is better to get an opinion from your specialist to know whether it is chickenpox or something else. Neem and turmeric is being used since ages for so many conditions, especially for skin conditions. I agree that neem and turmeric has an antibacterial action in it, but it cannot be the one-stop solution for all the skin diseases. We had used neem and turmeric paste For so many conditions, for example, if there is any injury or trauma on your skin, we had used it, and sometimes in localized infection we had used it, and most of the time it had helped. But this is not going to happen in case of widespread infection. If the infection is very widespread, you will definitely require an oral or intravenous antibiotic. This neem and turmeric is not going to work. So in such cases, please meet your nearby specialist. These are some of the skin myths and facts. I hope you have been benefited by this. If you like this video, please share and spread the awareness. Please subscribe for more videos. Thanks for watching.